Hello and welcome to the topic Triage Systems in the Emergency Medicine module. At the end of this session, you should be able to describe triage criteria at the hospital or emergency department and to differentiate case severity based on their presentation to the emergency department. Let's get started. The word triage is a French word which means to sort, and triage is the sorting of patients according to their need for emergency treatment and evacuation. In the hospital or emergency department triage, patients are triaged in a different zone in the emergency department, such as the red zone, yellow zone, and green zone, based on the severity and the urgency care needed for the patient. Basic principle is to triage life-threatening cases or injuries to red zones, semi-critical cases or limb-threatening injuries to yellow zones, and non-critical cases to green zone. The triaging is also dependent on the availability of local resources and manpower. Let's first take a look at the asthma bay. The asthma bay is a specialized area for the management of mild to moderate exacerbation of asthma or COPD that require emergency interventions and stabilization regimens. An example of a case presentation is as shown, where we have Mr. B, a 32-year-old male that presents to the emergency department triage with a complaint of having difficulty in breathing for a day. He has underlying bronchial asthma on metered dose inhaler. Upon arrival to the triage, the patient would be assessed at the triage by the medical assistant, or some departments, house officer or medical officer could be placed there too. Vital signs and general conditions will be assessed. So here is where we collect the vital signs as well as the respiratory system findings. The patient will then be sent over to the asthma bay for further treatment of nebulization and evaluation by the house officer or medical officer. Take note that this patient was sent to the asthma bay as his vital signs were stable. However, in more severe cases like moderate or severe asthma in respiratory distress, the patient would be sent over to the yellow or red zone respectively. Now let's take a look at the green zone. So the green zone is actually divided into green zone 1, 2, and 3. This is based on the requirement of resources in each zone. So in green zone 1, this is where most of the resources are required, as the cases may be then escalated to the yellow or the red zone. Next is the green zone G2, which is the zone that requires minimal resources, such as in cases where there's minor allergic reaction, minor trauma, minor burn injury, earache, acute infective eye conditions, and so on. Then we have non-emergency cases that would be triaged to the green zone 3, such as simple skin diseases, maybe missed appointments, or for medical certificates, and so on. So let's take a look at an example of a presentation in green zone. So we have Mrs. C, who is a 27-year-old who comes in with abdominal pain and no known medical illnesses before. So upon arrival to the triage, the patient would be assessed at the triage by the medical assistant, or some departments, a house officer or medical officer would be placed there. The vital signs are then collected, and then the patient would be sent to the green zone after registration for the following consultation and appropriate treatment to be given. Take note that for mild trauma cases with just some minor abrasion, wounds, and no limb-threatening injuries, stable hemodynamically would also be triaged to the green zone. Then we have the yellow zone. This zone is considered as high risk, and patients here would be seen within 30 minutes of arrival to the zone. They include high-risk situations, confused lethargy, disorientation, or severe pain or distress, or sometimes unable to walk but airway is secure, hemodynamically stable, and on trolleys. The type of case presentations here would be, example, altered conscious level, head injury with still GCS being stable, fractures of the long bones, active chest pain, eye injuries, vascular injuries, acute abdomen, poisoning or drug overdose, elevated blood pressure, and arrhythmias with a heart rate of less than 150 or more than 60. An example of a case would be a 4-year-old child being brought in by his mother, as noted child having rapid breathing with temperature more than 40 degrees at home. So here triaging is done, the vital signs are then assessed, and this child will be sent to the yellow zone for treatment and further management in view of being tachypnic with subcostal recession. However, when the child presented with additional or intercostal and suprasternal recessions, child will be considered to be in severe respiratory distress and sent to the red zone. Finally, we have the red zone, and this zone is the critical zone where patients here would be seen immediately as soon as they arrive into the zone. It is called as critical because it requires immediate life-saving measures. The type of cases that would be presented here are cardiac arrest, stridor or respiratory arrest, unresponsive trauma patient, severe bradycardia, hypotension, trauma patient who requires immediate fluid resuscitations, chest pain, anaphylactic reaction, a flaccid baby, unresponsive with history of poisoning, hypoglycemia, severe crush injuries, near drowning, and many more. An example of a case would include a 56-year-old man who comes in with crushing left-sided chest pain brought in by his wife. Here we have collected the necessary vitals, and we notice that his pain score is pretty high with diaphoresis. So he's then immediately rushed to the red zone. These types of typical case presentations would be rushed into the resus without time wastage as the triage for vital signs monitoring. These are the patients who are in a lot of pain and unable to give any history and able to identify from the first look of the patient. We have now come to the end, and it's really important to know that the criteria as well as the typical case presentations to the emergency department for triaging. Some patients would require an immediate intervention, and you would not want to delay as time is precious, and that might be a reason to have the patient's life saved. So we have come to the end of this session. We hope it was insightful. Thank you for your time.